Hi, my name is Bonnie, and this presentation is on diabetes. So what is diabetes? It is medically known as diabetes mellitus. It is a group of disease that affects the way your body uses sugar, also known as glucose. This disorder is characterized by an elevated level of blood glucose, insufficient production of insulin, and inability to use insulin effectively. When we eat, our body turns the food into sugar, which is then transported into the bloodstream. Glucose is essential because it is the main source of energy that our body needs to function properly. The pancreas secretes insulin, a hormone that helps the glucose get into the cells and acts like a key. There are three main types: type 1, type 2, and gestational diabetes, which occurs during pregnancy. Type 1 diabetes, also known as juvenile onset or insulin dependent, it is often seen in young children. The pancreas produces little or no insulin at all. An autoimmune disease where the body attacks its own tissue, destroying body's ability to make insulin. Type 2 diabetes, previously known as adult onset or insulin resistant, but there has been a spike in type 2 diabetes amongst children as a result of being overweight, so this affects both children and adults. It occurs when insulin is present, but the body is unable to use it properly. It is the most common type of diabetes. Here are additional information regarding type 2 diabetes. Gestational diabetes occurs during pregnancy, typically goes away after your baby is born, and there is a higher risk of developing type 2 diabetes. Demographics and trends. Diabetes affects people of all ages, genders, races, and ethnicities. African Americans, Hispanics, and Native Indians are at a higher risk of developing diabetes. Rates by race and ethnicities are listed: 7.5% of non-Hispanic whites, 9.2% of Asian Americans, 12.5% of Hispanics, and 14.7% of American Indians are all affected. Statistics. Gestational diabetes affects 10% of women annually. In 2018, 34.2 million people had diabetes. Roughly 1.6 million Americans had type 1 diabetes, including 187,000 adolescents. There are 1.5 million new cases of diabetes diagnosed every year. And in 2017, diabetes was the seventh leading cause of death. 83,564 death certificates showed that it was the underlying cause of death. Potential warning signs to look for: polyphagia, polydipsia, polyuria, tiredness, unexpected weight loss, slow healing process of wounds, and blurred vision. Diagnosis. A simple A1C blood test can tell you if you are pre-diabetic or diabetic. Risk factors include family history, age, pre-diabetic, overweight, over the age of 45, and physically inactive. Here are risk factors associated with type 2 diabetes. Protective factors include lifestyle changes such as losing weight, increasing physical activity, and eating healthy. Health problems associated with diabetes are blindness, kidney failure, foot amputation, brain stroke, high blood pressure, and nerve damage. Treatment include insulin therapy, visiting your doctor regularly, meal planning and eating healthy, and taking insulin medications. Here are my references. Thank you for watching.